I meet the roll call.
All right, I'm glad you're here. Can you hear me okay?
Yes, I can hear you, Madam Chair. Unless you know up front here that because of some health issues, I will be attending most of the meetings, if not all, until my term ends, virtually.
Okay. Thank you. You're all right? Okay. Just holler at me if I forget to speak loud enough. Yes. Okay, we will call this meeting of the Health and Human Services and Veteran Standing Committee to order. We'll start with Pledge of Allegiance. Don, online, do you want to lead us in the Pledge of Allegiance?
Yes, when you're ready.
We're ready.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Don. We have proof of notification? Yes. And I will need a motion to approve this 16-point agenda.
So moved.
Thank you, Ken.
Second.
Second. All those in favor, please say aye.
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 Any opposed? Great. Did you all get a chance to look at the minutes? Any changes or corrections? If not, I'll take a motion to approve those.
So moved.
Thank you.
Second.
Second by Supervisor Brenish. All those in favor, please say aye.
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 Opposed? Okay, is there anyone from the public who wishes to speak for public comment? All right, hearing no comment, we'll move on to the 2023 VSO budget summary. Hi, Karen.
Hello, so the budget has been, we were under budget again this year, thankfully. That ARPA grant that helped cover salaries, was a blessing. And that's pretty much it. So I'm back to the general fund. If anyone has any questions, we've had a couple expenses so far this year, nothing major. And so we're only 11 days in, but if anyone has any questions, I'd be happy to answer.
So how much went back to the general fund? Is it the, it says remaining balance 16,229, okay.
The ARPA grant was for $14,220. So that's why. Oh, that happened.
Excuse me, I didn't hear that. What is the reason we have an excess in the budget?
We received a grant for $14,428 from ARPA through the state Veterans Affairs Office. And so that went to salaries.
When did we receive that grant?
February of 2023, I believe.
I see. And that was applied to various or
It went straight to salary.
I see. So, and so 14,000, and you're 16,000 over.
Under.
That's what I mean. You're
Yes.
16,000 under. Now, you would not have been under had you spent this $3,000 for needy families, would it you?
It was not requested for the year 2023, no.
I know, but you didn't have any request or you didn't disperse any money from the needy families fund.
I did not receive a request.
Yes, you said you didn't receive a request. All right, thank you.
Do you have an admin report?
I put in the attachments, the final numbers for the year 2023. As you can see, our numbers have increased in 2023 compared to 2022. We are completing more applications. We're getting a lot more walk-in visitors now that COVID is finally ebbed, I guess you could say. But now that the winter has come, I expect to old flu season to maybe make our numbers dwindle, especially now that snowstorms are finally coming. This is usually the time of the year when people start saying, what am I gonna do for health insurance? I need to look at new numbers. And they're also looking towards tax season. And we start doing a lot of documents for the veterans to get their tax, what is state taxes, and if they're rated at a certain percent disabled, then they pay their property taxes, and then they ask the state and they get them reimbursed if they're 100% service connected. The last time I checked, there's about $176,000 that gets refunded directly into our pockets of our veterans if we can get them, and that's kind of the ultimate goal for our office.
I have a question, Madam Chair.
Go ahead, Supervisor Steve.
So Karen, you mentioned this is the time of the year that people are thinking about health insurance. How many applications have you had for health insurance? You got that form there, I'm sure. 1010 EZ, I think it's called. How many people have signed up for health insurance in the past year?
Hold on just one second. I got it. My eyes aren't as good as they were. So for the 1010 EZ,
Yes. That's on your form, isn't it?
yep. Oh. Do you want to make it smaller? 19, it looks like.
19 people, about one a month, so that's pretty good.
That's on the attachment. If you get a chance to look at it later.
I understand that. It's a little difficult for me to see. That's why I'm asking.
Oh,
questions.
yep.
And what is the highest number of requests you've had on your various applications for assistance? Which one is the highest?
Probably the 21-526 EZ.
Pardon?
The application for disability benefits, those are the ones we do the most of.
Okay, how many of those did you have?
Don, if you can, I don't know if you can see the 2023 forms.
No, I cannot see.
Okay.
With this computer, so that's why I'm asking these questions.
Okay.
69.
How many?
69.
69 applications for disability, and are all of those pending?
Not all of them. We have right
Okay.
around 44 pending.
You said at the last meeting you had 39 in process. So that's quite a jump. Well, that's total for the,
Well, the last meeting we had, I said we had 39, and now we have
Yeah.
44. And if you look at the number for December, it was 39 plus 5, which brings us to 44.
I see. And are they all open cases?
Yes, we're tracking all open cases, 44.
Okay. How many cases have had positive determination in the last year? You probably don't have that on your form, but you maybe can recall.
I know for sure that we had 3 that were denied, that we did not appeal after the
Yeah.
veterans read their logic. But most of them that got denied, they choose to appeal them. So then again, it opens up a new case.
How many of those 40 some cases that you have are under appeal at present? Or-
Probably a little bit higher number than usual. I'd say probably 5 or 6. And the reason why is because thanks to the PACT Act that now includes hypertension as a presumptive for Agent Orange. If they applied for it back in 2017 and were denied, then because it's now a presumptive, you have to appeal that decision in 2017. So that brought a lot of appeals back into the office.
I recall in the past year or so, there was an announcement from the VA liberalizing eligibility to most veterans for health care. Can you give me the exact eligibility requirement?
The eligibility requirements.
Almost everyone eligible?
What was that last part, Don?
Isn't it true that almost anybody is eligible to enroll in health care now? As long as they meet the means test?
It's the means test, but there's also other contributing factors. Sometimes if they know that a veteran was exposed to nuclear radiation in service, they throw the numbers out and they don't necessarily tell anybody why they're adding people. So sometimes people, they get accepted and enrolled even when it wouldn't look like they were eligible on paper.
But almost anyone now can enroll in the VA health insurance plan. Is that right?
Not necessarily anyone, it still has to be less, honorable or generable, less than honorable. It can't be.
Yes, I know those exceptions. Otherwise, the door is open for almost anybody.
Well, we definitely apply for everyone, but there
Yeah.
still are limitations on means and income and they look at everything. So number of dependents and they roll it all into one.
So
This-
in the past month, you had how many did you say come in and applied for health insurance?
In this past month, there was one.
One, I see. So those disability applications obviously take a lot more time for your office than probably anything else that you assist with.
It takes a couple of different office visits, but the final visit's usually approximately 20 minutes. To get the final product out the door. The 526 and preparing for that claim is usually takes the longest. Trying to track down medical records and bring in witness statements and buddy statements.
I imagine that generally the only document the veteran may bring in is his DD Form 214, and then you have to assist him from there to collect the other documents.
A lot of times we have to assist them bringing in their DD 214 too. Sometimes we have to track those down through federal and state websites.
So his initial intake is determining what documentation you need, and then either you proceed with it or you have him bring his DD Form 214 in next time he comes.
If I can't find it anywhere online, ultimately the veteran is responsible for bringing it to us.
Yeah. So your initial intake depends upon how much documentation he brings in, I suppose.
And what he's been diagnosed with, what type of disabilities. If he claims to have something and it's not on paper diagnosed, then he's gonna have additional doctor's visits before we can file anything.
Sure. So
Don, can we open up the floor to see if there's other people who have questions?
I didn't hear you.
I think we're gonna check and see if anyone else has questions and then
Yes,
move on, okay?
I've asked enough questions today.
Is there anyone else who has any questions or do you have more report of any kind?
No, that's it. We're still working on our office review. I said last month, for those that weren't there, we have updated over 2,400 names into the system so far, and we're keep plugging away. And our office, I was also chosen to be a representative to try out the new computer system that the state is putting out, VBAPS 2.0. And we had our first lesson so that we were able to make suggestions, and so we're still going through that. That's pretty much it. The headstones is going on. We've got a couple of events coming up that we're speaking at, but everything's rolling along smoothly.
Great. Okay, thank you. All right, we will move on then to our consent items. The HHS expenditures report, budget summary, and contract restraint. Anything to comment on the expenditures report?
got approval to pay them all.
Well, good.
So that was good. I just wanted to note that, as you can see, we've got some 2023, 2024, so we're really starting to kind of see some of those come in. Just a note on the 2023 prepaid vouchers, that's really high. But there was a method to my madness with that. There's a sort of an accounting workaround that we have to do to post things back to 2023. So there, that last week of December, I really tried to get some bills paid, so that we didn't have to go through that process. Yeah, so those will start winding down, but that's really just my only real kind of note I wanted to make, because that is particularly higher than normal for prepays. Anybody scroll through, look at them, anything jump out, you have questions about?
I think it flipped on our,
Yeah.
thing, so it was a little hard to.
Wacky, so I apologize. Next month I'll try to make sure it's.
There's no way on this to.
I don't know, I'm not techie enough to try to, but yeah, I was
Yeah, I
like.
try, I don't know if it works on
I'll try and make sure that that's flipped the other way for everybody the next time. Yes. Like lay on
our.
this.
See it rotate.
Yeah.
I think we've tried before.
Yeah, you have to
For-
rotate it before, so.
For the budget, is this then finishing up now through December, or do you think we'll have more still?
We definitely will have more coming in, from salary and benefits, that's done. So that's done, those expenses are in there, they're solid. But we still have, several invoices trickling in. So for our CCS program, those invoices we might even see into, February. So some of those kinds of things we'll still see. But as far as salaries, that kind of stuff, that's done, so that's in there. I'm trying to think what else would be in there that we'd still be waiting on.
I don't know if you just want to go through a little bit where we ended up then for the year.
Sure. So if you look at percent utilized so far, I know it says 100%, but like I said, CCS is really technically only through November that we, have the expenses for. So you're gonna kind of see that. So utilization, we're gonna definitely be under. And then, of course, we have the revenue that we're still waiting on to come in. I'm looking at a core balance. I swear I updated that to November, but that's fine. Core balance, we're looking at about 175,000. If I can find my budget sheet, I can kind of give you of that 175,000, about 60,000 of it is an IM revenue that we didn't get posted back to 23. So we have to keep in 23. Little things like that is why this revenue, by the core budget is going to look like it's a little bit. There's a surplus in it, so to speak. Can't really think of anything that was really out of ordinary. It's definitely less than last year as far as any surplus. But we had a lot of filled positions this year, which was really good. So in the past, we've had some vacancies and things like that. And of course, we had to make a huge cut to our budget last year. So there just wasn't as much wiggle room. So that.
On the placements, it looks like you've got through November.
Correct.
Do you think, so I know our adult placements are under, but our child is over. So do you think between the two of them, we're gonna end up okay?
It'll be tight.
It'll be
It's
tight.
gonna be real tight. It's gonna be real tight. Yeah, so because there's only 1 month left, you could really just take what a normal month would be and just add it on. Because I don't know of anybody that's not gonna be in a placement, that wasn't in a placement in the month of December. Sorry, that's shaking. Right, so like for the adult placements, you could, to that 621,000, you could add about 5 and 38, you could add, whatever, 40. I made 43,000 to that 621,000. I know if you go back and you look at, but then you can also add our institution, our Winnebago Mendota charges for December are gonna be about 30,000. So you can add those to that 621. So that's gonna be tight. And then children's the same thing. You could add 14, 45, 2. So yeah, it's already over 60, almost 60,000. So those are gonna be tight. What this report doesn't reflect though is the revenue that we receive, so even though the expenses are over from a revenue perspective, we can come in and we can cover a lot of this, right? What you're seeing in here is revenue from like social security and insurance and things like that. But for like the children's placement, if there's any funding left in, their DCF base allocation, I can take that and I can plug that into the placement fund as well. So while we may be over budget, the revenue should help make it not look as rough as Trish is looking at rough. That's the nature of the beast of the placement fund, you just never know who you're gonna have to place to help out. So.
Any questions?
Money that you're receiving from the state, that cover majority of the expenses that you expect?
Right, yeah, so if you look at the revenue, are you talking just placement funds or budget in general?
Either.
Either?
To make us more.
Sure, yep, absolutely, yep, it comes in, helps make us whole in a lot of areas.
Not as bad as it seems.
Right, yes, so, right, so yeah, so if you look at like our core budget balance, that's gonna be in the surplus. And then I always take a peek at the checking account for this piece.
We're always hoping that the state will let loose some of that $4 billion.
Right, yeah, we're drawing down everything we possibly could. I don't think there's any.
Keep rattling their cage.
Hmm?
Keep rattling their
Keep rattling the
cage.
cage, yeah. And I don't think there's any allocation that I haven't been able to draw everything down in that I can't think of off the top of my head.
Thank you.
Draw down whatever I can.
Great, contract monitoring report. Oh, there's a few over, but you highlighted them. There are a few over, and then I did highlight ones that looked at 100%, but we are invoiced through December, and those are done for the year. The ones that are over by the end of November, they are on the amendments. Okay. So if no one has questions on the actual report, we'll go to the amendments where she's addressing the overages. So that is number 12 in your packet. So these are cleaning up any overages that we had on contracts for 2023. So the first one we're looking at amending is family support services. It is utilized by our child and youth services unit. The original contract was for $9,500 and we're looking for $1,800. The second one is for Ferguson Consulting. It is utilized by our behavioral health services unit. The original contract for that one was $2,500 and we're looking at $2,600 to cover the overage. Great. Any questions? Otherwise, we're going to need an amendment specific for this one before we move on to the next.
I was just making sure they're all on.
Thank you, Lee. Do I have a second?
Sure.
Francis? Any further discussion? Okay, all those in favor, please say aye.
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 And any opposed? Okay, so now we'll go to 12B, which has some 2024 contracts on it. Nothing to amend yet. The first one we are looking at going into contract for is a continuation from 2023 with Veropa Nutrition and Counseling. They provide recovery, education, and wellness management services for individuals enrolled in our CCS program and our behavioral health services unit. We're looking for $1,500 for that. 15,000, sorry. The next one is physical assistance. That is a new contract that we're using in 2024. It is used for families in our CLTS program. I believe it's just pass-through funds. They help manage the funds that they're using. We're looking for 40,000. The next one is Iris Health Clinic, Woods Crossing. They provide AODA services inpatient for adults being served by our behavioral health services unit. We're looking for 6,000. That one we used at the end of 2023. Sunshine and Giggles provide services for children and our child and youth services unit to fulfill safety plan implementation. We're looking for 9,500. And Mo's Transitional Living Center is a group home for a youth being served by our child and health services unit for 49,500. All right, anybody have questions? Yes, Lee.
Is this similar to what we've done in the past? This is most-
For which-
budget.
Yeah,
And
Yep.
I'm saying there's not a lot of variation.
No.
Again, I think we got it.
thank you, Lee. Do I have a second?
Second.
Thank you, Ken. Any other questions or discussion? All right, all those in favor, please say aye.
Aye.
Any opposed? Okay, number 13, approve resolution to honor Joanne Welsh, Elder Benefits Specialist.
So Joanne was with the county for 39 years. She retired last week. She was a great employee. She was our elder benefit specialist. Did a wonderful job. We talked with her this week and found out that she still has people calling her at home because she is so trusted. Something, well, help encourage people to call the office because we do have somebody else that can take the reins on that. But I think that's just a testament to how great Joanne was. She was always willing to help out. She was noted across the state for her expertise. She was on different committees. And so we just would like to have a resolution to come board.
Okay.
Since I've known Joanne since 1978, I'd like to make this motion.
Yeah, so 13B has the actual resolution if you guys want to look at the language, but Ken has made a motion to approve it. Do I have a second?
Second.
I lead,
How
okay.
come she retired at age 39?
She would love to do that. All right. All those in favor, please say aye.
Aye.
Any opposed? Hey, and a big thank you to Miss Joanne Welsh. All right, so that takes us to 14, which is our administrative report from our director.
So I have submitted in the file the reports from the different units. And I think the only other thing that I wanted to report to you is we did send out staff surveys. And so those are all due back, or I'm expecting them back by the 15th. And then hopefully next month I'll have a report for you on results and plans for what do we do with it.
Did you all get a chance to look over the report? Any questions for Tricia? So, under the birth to 3 CLTS CSD, it says we scored 96% on our CLTS review. Can you tell me a little bit about what that review is?
So what they do is they come in and they look at our files,
Uh-huh.
making sure everything is up to date on the files, but also looking at benchmarks. Are we meeting benchmarks? Are we providing the services that we need to? Are we meeting timeframes?
Okay,
And so they really break it down into each of the different categories that they look at. State average is, I believe, 86 or 87, so we were above state average.
nice job.
Congratulations on being fully staffed.
Yeah.
Yeah, that's the thing to celebrate nowadays.
Very well written report, thank you.
Yes, thank you.
So when the state says they're on the ADRC, when the state says they're gonna hold us harmless, that basically means they're gonna fund it a different way.
Yeah, I was a little confused by that language.
Not gonna punish us. So, okay, years ago when the ARC funding was set up, we were a generation one, so we were one of the original ADRs. Just because of that, we received more funding than other counties of our similar size. So they came out with a new funding model and said it's all gonna be different. And we were expecting that by 27, we were going to start to get a decrease in funds. They have since come back and said, no, we're not going to decrease funds. They're really looking at it from the perspective of our population is aging. We don't want to have an increase in services or have to cut services. So the state has said we'll continue to give the exact same amount. We probably won't get more, but we'll continue to be able to maintain where we are at. So what's
So potentially in that funding change, we could have lost money.
correct? That was the original plan. Yes.
It's nice to see that little light shining out of Madison.
It is. It is. Yes, it is. I think they see the value in ADRCs and what they bring to communities.
Just makes me nervous when the government says they're gonna hold me harmless. Shenanigans.
That's right. That was our buzzword last time.
Something on here about training. Training.
Our newest worker, Marissa, will be doing some trainings. So it'll be our state training to be able to do on-call for the children and youth services and then also her forensic interview training.
I don't know, maybe I was dreaming because when I saw you were doing some like silly training and now I don't see it, so I must be.
Leadership Academy.
Maybe that's what it was.
Last month, yeah.
Oh, that's what it was. I was reading through the notes of last month.
Okay.
Sorry,
yeah,
I'm
that's
like,
okay.
did you guys already do that or what?
It'll start in March.
Okay,
Yeah.
and what is it? I know, I'm sorry, this was last month, but just to,
So it's through Southwest Technical College, and what they'll be doing is it'll be once a week for 8 weeks that they will come in and do leadership training. So they'll look at your strengths. I'm trying to remember what everything
do
else
they
was in
meet
there.
like with individual departments or is this just kind of like a big open?
It'll be our leadership team. So it'll be myself, the managers, lead workers, the confidential administrative secretaries, and the supervisors. So there'll be 13 of us total that'll be a part of it. There's going to be one other department head that'll be joining us. And it'll be for 4 hours at a time. So this is something that they provide to businesses, agencies throughout the area.
Yeah, and we are looking to do this actually, the goal is to do it with all supervisors, the board members and all department heads as well. So this is we're gonna see how this works. And actually I am speaking to the Southwest Tech board on the 25th of January. And before that, they're gonna give me a tour. And before that, I'm meeting with the head of who organizes these to talk about the potential of setting something up once the new board members are on. So yeah, this has been a catalyst for a much bigger conversation and it's really exciting. And to your point, Trish, they talk about coaching, they talk about leadership, they talk about playing on each other's strengths, difficult conversations, I think is part of it. So yeah, it's a really all-encompassing program and those who have been through it that I've spoken to really said they found it very, very valuable.
If you look at last month's folder, we do have a 2-page sheet that outlines what will happen at each of the different sessions.
I've been having trouble getting,
Do you have an email too?
no,
Yes.
it's just my iPad has been acting really weird, like pending and like not
That's right.
syncing things. But I
But unelected officials.
think it started. Alright, I'm gonna have to try to get it later. It's not,
And if you can't, just email, I can send it to you.
okay. Anyways, that's exciting.
Yeah, we're very
Looking
excited.
forward to hearing how it goes. Okay. I'm losing where I'm at. Okay, so future agenda items. I know you mentioned the results of the survey. Anything else that you see on the docket out of our work?
Last night.
So, not that I can think of right now.
Okay. Anybody else have something?
Just
Yeah, yeah.
a question, Tricia, is there anything else we're looking for in this coming year that we might have to address? Sure.
No, not that I can think of.
Knock on wood.
Yeah.
More like pandemics.
What about Candace, as part of the overall board, is there anything that we need to, is there anything you consider
I think there will be changes coming. We are looking at, as a whole, revising the county board rules and the committee structure.
The rules on,
For county
The
board members.
county board
is there
members,
anything specific that you're looking at?
there's a lot. Yeah, there's a lot, coming into statutory compliance for one. And we're looking at best practices. We're actually engaged with Andy Phillips from WCA. He will be assisting us in this endeavor to make sure that when we do it right, we do it this time, it's gonna be done right the first time, so we're not having to redo. And that may impact this committee in one way or another eventually. We just don't know that yet until the board kind of puts what their wishes are out on the table. We won't know what that could potentially look like. So there's that. We are doing the wage study. That won't really necessarily affect this board, but it will affect the employees that this board serves. And I think it's a really exciting endeavor and looking forward to that. So, and who knows what else? Strategic planning, we'd like to revisit the strategic plan. And so there may be some updates for this committee, or we may ask this committee for suggestions or ideas, thoughts on what they think could be moved forward. Because we've accomplished some things on our strategic plan, and so it may be time to revisit and replace or add some new. So there's a lot happening.
So
So
we basically been in compliance. It's just a matter of keeping up with the changing times.
no,
No, we haven't been.
We haven't been in-
Problems that,
we haven't had problems, but it's, as I've become familiar with statute and practice, we've realized that our board rules do not always align with statute and practice and the practical applicability of the law. So we're gonna make sure we fix this.
okay, thank you.
You're welcome.
So, this is number 16, adjournment. If nothing else, I'll take the motion to adjourn to next month.
So moved.
Okay, thank you. All those in favor, please say aye.
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 Hey, y'all.
Yeah.